My name is Raphael and I come from Cameroon, and I will be presenting my research work now entitled Needs, Demand and Supply of Healthcare in regard to growing, emerging and re-emerging diseases in Sub-Saharan Africa. Allow me first of all to state that access to healthcare services in Sub-Saharan Africa is a real and important issue because it looks like because of population inability to. I'm not seeing my presentation, please. I cannot scroll on my presentation. Where should I go? Yeah, so I was saying that.
Medang,
what should I do?
Yes, you can navigate. You can use the navigation buttons, which is in the top left corner, down at bottom left.
I'm using it, but it's not working.
You can use it as previous and next page. Can you see it? Previous and next page. You can see the arrow mark there.
Okay.
Okay, fine. You can continue. Medang, you can continue.
Okay, can I start again?
Yes. No,
okay.
You continue.
So I was saying that. Okay, thank you very much. I was saying that access to healthcare services in Sub-Saharan Africa represent a real and important issue because of population inability to obtain health services in a context of emerging infections, and also because of incapacity of the health system to adequately respond to the needs of the population. Therefore, our objective in this research work was to determine the extent of emerging infection in Sub-Saharan Africa and analyze population and health system ability to face these causes, knowing that emerging infection can be defined as these infections that have newly appeared in a population or that have previously existed and are growing in incidence and geographical range. Then we carried out a historical review on needs, demands of healthcare, as well as public health surveillance in relation to economic and social impact of emerging and re-emerging diseases in Sub-Saharan Africa. However, one can be tempted to ask the question, what is the problem? The problem here is the resurgence of emerging infections in Sub-Saharan Africa due to many factors such as agricultural and ecological changes, interruption in immunization programs, but also international travel or inadequate control of water supply. In addition to this, we should also mention that neglected tropical diseases and non-communicable diseases are now becoming also emerging diseases in Sub-Saharan Africa. All of this will conduct to high prevalence and high disease burden, with as final outcome a big challenge which is made of poverty and inequality in relation to health. As we all know, a new infection first appearing anywhere in the world could traverse entire continents within days or weeks. Recent examples of emerging diseases in various parts of the world include HIV/AIDS or classic cholera. But to really apprehend the situation, on, or as far as emerging infections are concerned in Sub-Saharan Africa, we should first of all understand or observe the overall health situation in Sub-Saharan Africa, which is made of increased unmet needs, poor level of response, poor public health systems, low technology, and out-of-pocket financing. And when we talk of out-of-pocket financing, we need to, or we are saying that population and families are seen as the main contributors or the main donors, leading to an increase to people poverty. But also, we should consider the fact of poor level response and poor public health systems, which are characterized by lack of human resources in terms of quality and quantity, but also characterized by governance issues such as corruption. We have also mentioned increased unmet needs characterized by high demand of health services, increased level of emerging diseases, and finally, increased disease burden. Therefore, our methodology consisted on a historical literature review on emerging and re-emerging diseases, including needs, demands, and responses. We reviewed a number of articles, scientific articles, books, and documents published between 1995 and 2015. 37 scientific articles were consulted through PubMed, Medland, and Google Scholar. Out of these, 21 were eligible for this review, which has as language criteria the English language. However, we must admit that reliability of estimates or data presented by selected authors were not accepted, but we collected information for a comprehensive review of emerging and re-emerging diseases, needs, demand for services, as well as provision of healthcare. In terms of results, we first of all had to observe that emerging infection or emerging diseases can be classified in 4 groups. The first one being the viral emerging infection, the groups of viral emerging infection, in which we can have infections such as Ebola, HIV, hepatitis B and C, or more other infections such as Lassa fever. The group of bacterial infection in emerging diseases made of diseases such as Legionella or cholera. The groups and also the group of parasitic emerging diseases, in which we have diseases such as malaria, schistosomiasis, and you name the rest. The 4th group is the one made of non-communicable diseases as well as neglected tropical diseases, which are also appearing as emerging infection diseases. And when we are talking of neglected tropical diseases, we observe that they affect the poorest 500 million people living in Sub-Saharan Africa. The burden of neglected tropical diseases may be equivalent to up to half of Sub-Saharan Africa's malaria and more than double that of tuberculosis. Out of the estimated 181 million school-age children in Sub-Saharan Africa, almost half are infected with soil-transmitted helminths, and out of the world's 207 million estimated cases of schistosomiasis, 93% occur in Sub-Saharan Africa. That's around 192 million. Probability of death from non-communicable diseases is higher in Sub-Saharan Africa than in established market economies. Nevertheless, out of this dark picture, we also came to observe that there are some positive initiatives, such as the Cardiopad project in Cameroon, which appear like a ray of sunshine in relation to the detection of cardiovascular diseases. Still, under the chapter of the results, we have here a table showing the disease burden in terms of disability adjusted life years in Sub-Saharan Africa resulting from the neglected tropical diseases. And under this, we can observe that for some of the diseases, the estimated percentage of disease burden in Sub-Saharan Africa can be more than 90% for some of the diseases. This is the case of schistosomiasis, the case of the human African, African trypanosomiasis, and the also schistosomiasis, in which you have estimated percentage of disease burden going up to 93%, 100%, and 99% for onchocerciasis, respectively. In conclusion, we concluded that emerging and re-emerging diseases are really a major public issue in Sub-Saharan Africa, as they build upon poor public health system and lack of adequate resources. This will conduct to a high disease burden as well as economic and social disturbances. Finally, we have estimated that there is a need for further research activities, but also a need for a cohesive agenda to be put in place in respect to population needs, but also the ability of each other to be able to cope or to react against this new situation. These are my references, and dear host, ladies and gentlemen, thank you very much for listening.